can't look at myself. Okay, hello. We are live. I hope we've got an assistant with us. Awesome. We are live this evening with Wesley, Maternity Navigators, Jolinda Kelly, and Morgan Tracy. And we are so excited to have you ladies here this evening with us. We've worked with both of these ladies over the past several years for our Bloom event. So we're so thankful to have you here for our virtual event as well. Before we get started with our live Q&A, I did want to address that we have a giveaway, a very exciting giveaway. So we've got a Panasonic video monitor for all of you moms out there. And so all you have to do to enter to win is submit a question in the comments below for Jolinda and Morgan. And we'll do our best to address these questions while we're live, and those that we don't get to, we will do our best to get to in the comments after this live. So I'll go ahead and turn it over to you ladies. I know you had a couple of announcements, and then we will get started with the questions.
Hey guys, I'm Morgan. I'm the maternity nurse navigator here. And this is
I'm Jolinda. I'm the perinatal nurse navigator.
Here at Wesley, just not to confuse anyone, we are doing universal masking. Jolinda and I are in a small enclosed room, and we are part of each other's inner circle. So we aren't wearing it just for this event, but we will be having it back on as soon as we leave this room. So
awesome. Great. That actually was one of our first questions that came in tonight, was about masking during labor and delivery. Do moms in labor have to wear their mask when they're in their room or actively pushing?
So we have every patient and visitor wear a mask from the time they get screened into the hospital or into birth care. You're going to be given a mask. You don't have to bring your own. If you want to, you're more than welcome to. When we get to the room, you guys can take your mask off. We do encourage your partner or your support person to wear their mask when there are other people in the room, just to help keep that protection going. But Mama, you don't have to. We are encouraging use of masks when you are actively pushing. The only exception to this is if you talk to your doctor if there's something that's going to be holding you back on that, if you have extreme claustrophobia or something like that. But if you have done the pre-screen for COVID, so for our scheduled inductions and for our scheduled C-sections, we are having you guys come in about 3 days before to get pre-screened. If that comes back negative, then you do not have to mask during pushing. So, which is super nice. Yeah, super nice to not have to worry about. And then if you are in the halls at all, we do encourage you to wear a mask just in the hallways.
Babies in the time of COVID. I know we have lots of new moms here, so they've experienced that firsthand in the coming weeks. I know that we have posted your guys' awesome tour already, and so many people have viewed it, but we had someone ask, are you doing in-person tours right now?
Not yet. We're hoping soon. So yeah, no extra people in the hospital. At this point, even our visitor policy is pretty strict as that one person per patient at this time. And so I feel like it might be a little while before we can do in-person tours. So yeah, we are loving the virtual tour option at this point, just at least so people can get an idea of what to expect when they get here. And I'm still doing birth plans. We do either WebEx or FaceTime. WebEx is if you have an Android phone or if you want to use your computer at home, and then FaceTime if you have an Apple device, we can do that. So I'm still doing quite a few birth plans. Jolinda's done some NICU tours on FaceTime as well. So we're just kind of adapting to the times and trying to figure out what's going to work best for right now, which has been a fun adventure.
Yes, and just trying to keep everybody safe.
Yes.
Absolutely. Okay, we have, what is the best advice for a new mom during labor in general? I know that's a broad question.
It is a broad question. I feel like the name of the game in labor is to relax. The more relaxed you are, the easier it is for your labor to progress. It is also one of the hardest things to do during labor. So I know that anxiety tends to kick in, especially if you haven't ever had labor before. It's unknown, and in the unknown, it's a little bit scary. But the more you can practice relaxation techniques at home, things that you know will help you, make a music playlist, practice massage with your partner. And if you do essential oils or you have a favorite lotion that you like, incorporate that into that time 2 to 3 times a week before bedtime is what I really encourage mamas to do. That way, when you get into the hospital and you get into that unfamiliar environment and you have things going on that you haven't experienced before, that music, so that sound, the smell of that aromatherapy or that lotion that you like, and that familiar touch can all trigger your brain to help you relax when you're in that spot where it's really hard to.
Always do that beforehand and make sure that you incorporate your partner so that they know how to support you during that time.
That was another question we had. Is there something that women can do for their partners to help prepare them, not just for labor and delivery, but also for that postpartum period, especially for those first-time parents?
It's all new to everybody. But just that one-on-one talking and relaxation techniques and trying to get as much sleep as you can before, that is key, because you're not going to get much sleep afterwards. So,
and just learning each other. So this time before you have baby, make sure you spend quality time together, talking about things that you're nervous about after baby's born. Have those good conversations about those fears, and being vulnerable with each other is really going to help you to know what's going on with the other person after you have this new life with you. Your roles are going to change a little bit, and just discussing how that might look prior to having baby, and knowing that might completely go out the window and everything might change after you have baby. It's going to be okay. But checking in with each other is really going to help. If even just daily checking in, be like, hey, how are we doing? Are we okay? What's going on? How's your mind doing? Because postpartum is it's kind of a roller coaster. And it doesn't matter if it's your first baby or your fifth baby, it's still an emotional roller coaster.
Are they still calling it the fourth trimester? That was a big thing when I had my little one.
12 weeks. Yeah, girl. That 12 weeks is take it and keep it, and know that is a transitional time, and do not force yourself or your family to do more than you have to. That is where you guys are in. It's okay to be in survival mode and like figuring out how everybody's going to adjust to this new baby, especially if you have other kids in the home, learning how they fit in the picture, and just learning roles together as a partnership, and figuring out what works best for your family, and taking the time to do that is okay.
We have a lot of questions coming in. Actually, there are some that are following the same theme. I know that this is a big life change, even not in 2020.
Right.
So my heart really goes out to these mamas who are navigating these waters
of COVID
now. So we've gotten a lot of questions about visitor policies, siblings being allowed in. Are they all kind of along that line?
Just visitors in general. So if you could maybe talk about some of the, and I know we actually have a resource that you guys put together. You put it together, Morgan, and it's great. So we could even link that in the comments. Addressing some of these questions, but maybe the ones that we're seeing is specifically visitors and younger.
The current visitor
NICU, if you can touch on NICU visitors.
Yes, I'll let Jolinda touch that one. General visitor policy is one person per patient. So one support person for mama. They can have one alternate. So if that support person needs to leave, if you forgot the things at home, if they need to get out of the hospital and they just want to take a shower and a nap at home, you can have one person take their spot. You can't just like switch out people. And so it's got to be the main two people. So it'll be your main support person and one alternate who can take their spot. And we want to keep it just to those two people. If you have a doula, that they are counted as part of the medical team for labor. And that's the only kind of exception to that. So, but yeah. And then in NICU,
it'll just be the parents that will be allowed in there. So, and it's one person at the bedside at this time, just to keep out the amount of people and keep those little ones that are so vulnerable safe.
Yeah.
So, but there's no visiting hours for parents. They can come at any time because they're the parents. We're here to support them.
We're getting several questions about your suggestions for what can parents bring to the hospital. So like, what would you say are the necessary items for parents to bring?
I did do a video also on our Wesley Facebook page, the Wesley Birth Care, about what to pack. It's kind of basically what I packed with my third kid, but it also shows you what we have here at Wesley for you after you deliver and for your baby. I think so I did just have my fourth baby in November. Thanks. I didn't have time to grab much. Nope. So I had the diaper bag packed basically. And what did I have in there? I had a change of clothes for me. And like nursing bra was like, I wanted that. because I was planning a natural delivery, I suggest nursing bras for natural deliveries because you at least have some sort of coverage, because trust me, the gown is the first thing that goes out the window. I mean, really. So, but so I feel like that's a big deal. And then you can still do breastfeeding. You'd still have skin to skin, but you still feel like a little bit more coverage, more comfortable in that. Your own pillow, that's sometimes helpful. Just so you have that comfort item. If you
that was a question. So you are allowed to bring in your own things from home right now.
I would suggest that.
Yeah. I agree.
Yeah.
And if you have like, some people have like a fuzzy blanket kind of thing. If that's something that helps your anxiety, bring that. So aromatherapy, you can bring essential oils in if you want to. So when we can put those on washcloths, or we can do it on cotton balls, however we need to help get that where it needs to go. So, and then I feel like those are like the main things. Your music, your phone, bring your phone, have a playlist on there, bring your charger. That's cool
charger.
Yeah.
First outfit, or like going home outfit for baby.
Yeah, bringing home. Yeah, going home outfit for baby. You'll need to bring the car seat. You don't need to bring the car seat in when you're admitted, or like, so if you're here in labor, you can leave that car seat in your car until after baby is born. That's just one more thing that you have to bring in, and that's just too much when you're coming in labor.
Yeah, absolutely.
Yeah.
We asked about, we had questions about, can we ask a non-COVID question real quick?
Yeah.
Okay.
I
promise we're gonna circle back. We're gonna let kind of the COVID ones pile up, and I promise we'll address them again. It's all anybody can talk about right now, but we've got.
I think mamas are nervous specifically about the restrictions with COVID, but let's switch gears just a smidgen.
Yeah, we had a couple great questions about what birthing classes are looking like right now, and what you recommend.
We're still doing birthing classes, and we are doing them online, and they're free. Ruthie is our family life education coordinator. Her phone number is 316-962-2290. She can get you signed up. She's good, and she'll tell you what's available, especially if you give her your due date. She can tell you what's available before your due date, kind of how to prioritize them. Childbirth prep is by far and above. You need to take childbirth prep. Especially if this is your first baby. It kind of just goes into depth on all of the things that we would talk about in a birth plan. That just goes in more in depth with all of that. And then there's caring for your baby. That's a great one. There's a dad class that's super fun. There are some specialized classes like multiples and VBAC. And so those are really great ones too. Breastfeeding and returning to work. That is a magical class. Is very good, especially if you are planning on just doing maternity leave and then going back to work. It will help you figure out how to do that well as a breastfeeding mama.
Infant CPR, is that happening right now?
We're working on CPR still, because it's such a hands-on kind of thing. It is difficult to figure that out. So as of now, I don't believe we're not doing online CPR classes at this time, but we're going to figure it out.
Okay. What about breastfeeding and lactation support after delivery?
So our lactation clinic, the clinic part is not open, but the phone number is open. There can be appointments made if it's medically indicated. So we do have a limited number of those every day. And call. They have the ability to WebEx. So if they need to see you, or you need to see them to help with latch and all that, there's a safe way we can do that without worrying about hackers. Great. Like that. But they're still available, and they will leave a message. That 962 milk number is being monitored. So that voicemail is, you leave your contact info. We will call you back and chat with you, see if we can help you over the phone and kind of work through that together.
Breastfeeding support is so important to new mamas. So, and they're still seen by lactation specialists while they're here in the hospital, but just that knowing that there's somebody there to support you afterwards, even with all this COVID going on, is really important.
Mm-hmm. Lactation will see you every day you're here in the hospital, and they'll come check with you before this is. So. Yeah.
This is the question I've always wondered. Do nurses like it when you show up with a birth plan?
A birth plan is helpful, just so we kind of know what you want. I mean, this is your birth. We do want you to have a great experience. It doesn't mean that everything's going to go exactly like we want it to, but to know what your hopes are in case, things do change, but we can know where we're at on the birth plan and know how to accommodate that. If it's a super detailed birth plan, please call me. We can chat it through. We can talk about what are the norms here at Wesley, because many a times those online birth plans a lot of things on there are things that we already do here, like skin to skin, delayed cord clamping, stuff like that. So a lot of that we already do, and it's helpful just to kind of cut down through the mess a little bit, and like things that our nursing staff already does that they won't need to necessarily read. But we will write it out so that I have a nice 1-page, 4 boxes kind of birth plan, pretty easy for your nurse to look at and be like, okay, this is where we're at now, comfort measures. Let's see what we want to do here. Then with special instructions, which is right around delivery. And then we have newborn care that we talk about all of those things, and those, so your nurse can just quickly look at it, know what you want quickly, and make sure we're trying to follow it as well as we can, as much as baby lets us.
What's your average length of stay after delivery, and who makes that call or helps you make that call on when it's time to go home and start that next phase?
Average is 48 hours. If you've had a C-section, you might stay 72. And that's going to be up to your OB and your pediatrician. So even if mama is dismissed, but baby needs to stay for a little bit longer, just for keep eyes on, for whatever reason, we're not going to kick mom out of the room because that's not cool. So you'll be able to stay in. So it's peds and obstetrician together make that decision, and it may be separate. I mean, like, it will be separate. Mom might be dismissed earlier or later, and baby you guys will still stay together.
It will be at least 24 hours before baby is dismissed.
Okay.
Going back to the lactation clinic, is there a fee?
Oh yeah, the clinic is currently closed, but for the phone calls, is there a fee associated with calling that milk number and
Nope.
your consultations while you're still under post-delivery care? That's all.
Yep.
Part
All
of
of it is free. Yeah, it's just part of the Wesley way.
Part of that little vacation, that little labor and delivery.
Yes. That's where you're learning how to take care of a little human.
Let's see.
Oh, so I skipped
Let's go back
over
to this.
earlier. Because it's top of mind and people are wondering about the COVID restrictions and next steps and maybe anticipation for changes. We have a lot of fall mamas that are here tonight that also a lot of probably type A mamas who are trying to play that.
A lot of first time moms right now. So
I know.
So I guess just, and I know this is what you do in your day to day. One of the questions that I keep seeing come up is, are there rapid COVID tests required for scheduled C-sections, or just in general? Is there a way, maybe just talk about the testing and all of that a little bit
We
more?
are doing pre-screening, but they're the 72-hour ones. It's what we're doing. And so pre-screening, if you have a scheduled induction or a scheduled C-section, we are having you come in and pre-screen for that. If you come in labor, or if you don't make it to your scheduled C-section date, as long as you don't have symptoms, we're not going to do that rapid screen. If you come in with symptoms of COVID, then yes, we are going to do that rapid screen, because we need to know ASAP what's going on so we can treat you appropriately. And then if you are having symptoms, it'll be a little bit of a different pathway than the one I showed you, because we are trying to keep our healthy mamas healthy. So we're doing a very good job of isolating those that we are concerned about in a separate area to keep everybody safe.
They talk about this one.
Okay.
One thing that we're passionate about talking about at Wichita Mom and connecting moms is perinatal depression and anxiety support. What are some signs and symptoms our mamas can be looking for? And what's a next step if they think they're experiencing it?
Right. Hormones are just raging at that time. And so that's where the partner comes in, and the communication, because sometimes the mom might not realize it herself. And so that partner will pick up on that. So, and then just having that open communication, and then knowing that whatever it is that you're feeling is true, because you're feeling it, and not to discount yourself. Or let anyone tell you, no, that's not how you should be feeling, because your feelings are yours. So we actually have an incredible support here in Wichita called the Village ICT that specializes in prenatal and postnatal mental health issues.
And they can help connect you, or they can do
Right.
services, like counseling services themselves.
If you experienced it with one pregnancy, one child, are you more predisposed to experience it again?
There's a likelihood
Okay.
that you will, but that doesn't mean that you automatically will. There's just that likelihood. And it might be just the fact that you noticed it the first time and you sought help. And so, the second time, I don't want to get to that point. So seeking help beforehand.
And just know that every pregnancy and circumstance is different. Also.
Everyone.
So, just be aware of what you're feeling. Obviously, if you have any thoughts of harming yourself or your baby, make sure you come here, go talk to or call your doctor, talk to your partner, make sure that they know it's okay. It's okay. We're here to help you and support you through that.
And postpartum depression, postpartum depression can look different for every woman. It's not necessarily, I don't have postpartum depression because I don't feel like I want to harm myself. It could be just, overwhelmed and not being able you're feeling like you're not completing everything that you need to, or just the high anxiety. So all of that looks different. It's not just, I don't have it because I don't feel like I need to harm myself or harm my baby.
Right. So I know, and we'll probably wrap up here in just a few minutes. But I know you ladies talked about this in your awesome tour video. You did such a great job, but maybe just tell us a little bit about your day-to-day. I know it's different every day and probably you got all kinds of stuff going on, but maybe just kind of the highlights that can really ease moms' minds right now, specifically first-time moms, but not even first-time moms. Like, this is a first-time experience for everyone right now. So maybe just talk about your roles and how you can ease. Morgan, I know you've said before that that's the question you get most often is how can I prepare for this? I'm nervous. And your role is really to kind of calm those nerves a little bit. So maybe just talk about that.
I believe education really helps with anxiety. Knowing what to expect and so if this happens, this is what should happen in response to that. And so I feel like education on birthing and on knowing what the normal plan is, then that really does help. Have and ask all the questions, and you can ask questions multiple times. Especially when you're here in labor, if you don't understand what's going on or you don't know what's happening, and you're like, I know I asked that like 5 minutes ago, but it did not sink in because there's a lot going on, and you have to remember, as nurses up here, we do this every day. Sometimes multiple times a day. And so we sometimes rush through our explanations. And so it's okay to ask again. Also, all of this, like I said, all of this is new for you. This is not something you do on your day-to-day. So if you don't understand what we're saying or you need us to explain it in a different way, ask. Our nurses are very good at education and letting you know what's going on and why. We may have to do things quickly, but we are always good at coming back around and saying, hey, this is what happened. I know it was kind of fast, but this is why we did what we did. Our OBs are also fantastic at coming, especially if it gets to the point where we need to move things quickly and have them be involved. They are very good at coming back and chatting, especially once things calm down and things, you're in a better spot to understand kind of what was going on. We can talk through all of that. And they're very good at educating past that.
And with me, if it's a high risk, a lot of times when the maternal fetal medicine doctors come in and they say a lot of stuff and you're overwhelmed anyway, and then a neonatologist comes in and tells you about the baby, and that's even more overwhelming. So I am lucky where I get to come in after all of that and just talk to you one-on-one. What did you hear? I know what was said, but what did you hear during that time? And what questions do you have that you didn't have when they were in the room? Because you never think of those questions while they're there. As soon as they walk out,
right,
that's when you think of the questions. So that's really nice that you not only have your personal nurse, but then somebody else that can explain those things.
Should we just have one more question? We will probably end it with one more question.
Sure. Yeah.
And we did get some variation of this kind of throughout here. And it just says, we're going to end it on COVID, friends. But could you explain the procedure if someone is tested positive for COVID? Just what is the expectation there? What happens? And do you separate moms and babies? I've seen that question a few times.
Right. So the entryway is a little bit different. So there is the check-in desk that people normally go to if they screen positive, though, we're going to come through a different way. We have some separate rooms that are designated for if we have someone, a PUI, a person of interest, who we're concerned about having these symptoms. So we'll place you in one of those safe rooms with your nurse. Your nurse will be dedicated to you. We'll do that rapid test and hopefully get that back. If you were to test positive for COVID, we would expect your support person to stay in the room with you at all times. If that were to happen, we wouldn't have your support person come and go. They would have to stay with you. And then we would have that discussion. The CDC has multiple recommendations, and then the American Academy of Pediatrics, we're trying to follow everybody's recommendations. So we're going to present that to you and have a one-on-one conversation during that individual circumstance, because not everybody's going to do that, and not everybody's going to have the same thoughts and feelings. That's what they want with their child afterwards. So we're going to explain risks, benefits, what we can do to help negate those during, like, if you do decide to keep baby in your room, what are we going to do differently? How are we going to treat that as opposed to if baby's in a different room, and how it's going to look for you. We honestly haven't had any issues yet. So we expect that everybody's doing a really good job. Good hand hygiene, good quarantining. Our mamas are taking a lot of good precautionary steps. And so we have yet to have that conversation, but we have things in place for if we need to have that conversation. It will be individualized to you, and we will not do anything without your permission. Is that
great?
That's wonderful. Well, thank you guys so much for your time tonight. There are far more questions than we could get to now. So I know we all have a little bit of sorting to do, but thank you for your commitment to Wichita moms and keeping us and our babies healthy. We so appreciate you, and we are so happy to have you here live with us tonight and then for the rest of the evening.
Yeah. Well, thank you ladies so much.
To see you.
Yes, thank you so much.
Have a good night.
Thank you. You too.